Assalamu alaikum and welcome to a health show. Today we're talking about another women's health topic, menopause matters. Now, as a woman gets older, they go through a very significant event in their life, menopause. And this can be quite a disturbing time for some women because they're going through emotional changes and physical changes, and if they don't understand what's going on with their body, it can be distressing. Now, the loss of fertility is the biggest impact that happens to a woman, and it can be seen as a blessing from Allah subhanahu wa ta'ala because a woman's body is getting older and no longer can bear the responsibility of having children. So in that sense, it's a blessing from Allah that we no longer have the responsibility to physically bear children, and we can then focus on ourselves, on our health and our well-being. So today we're going to be talking about what is menopause, what are the common symptoms of menopause, and how do we maintain good health and manage those symptoms. Okay, so what is menopause? I think it's very important to start with the fact that it's not a disease. Menopause is a stage in a woman's life, so it's a transition where she starts a new stage of her life. It's not a disease, though you have some symptoms and body does change. The other thing to mention that's really important is that obviously your periods permanently stop, and you have to wait about a year, sometimes 2 years depending on the woman's age, before we know that a woman has reached menopause. It's extremely important that if you don't want to have children, that you stay on contraception, just for safety's sake, for about a year after your last period. Usually women are around the age of 50 years old when menopause happens. For some women it may be younger, for some women it may be older, but the average is 50 to 52 years of age. Coming up to the menopause, women go through a transition period where the body hormonal levels slowly start to decrease and the changes slowly begin to happen. This is called perimenopause, and this is usually when women first notice the changes, and it is characterised by changes in the periods, hot flushes, maybe mood changes, and this is usually the time that women present to the GP. So let's talk about the common symptoms of menopause. Now, usually your GP or your nurse will be able to diagnose your perimenopausal stage just from the symptoms that you describe. Okay, it's important that you talk about these issues because often there's a lot of help that can be given if you're struggling with the symptoms. The most common one is changes in your periods. Now, often women will start having less frequent periods, maybe months will go by, the periods will decrease in frequency and in the amount. But however, some women start getting very prolonged and heavy bleeding. Now, if that happens, it's very important to see your doctor or nurse about it because sometimes, in some cases, it can be an indication of underlying issues in your womb, and it's good to get that investigated. However, in the majority of people, it's just a change in the hormone that does it. Along with the change in periods, women often have problems with hot flushes. Again, this is to do with a decreasing hormone in your body. The primary hormone that decreases in your body is estrogen, and that is the reason why you're having all these symptoms. Hot flushes are a very common symptom of perimenopause and menopause, and they can be very disturbing for women. They can range in the frequency, they can range in the severity. Some women might have an occasional hot flush in a week. Some women will have hot flushes every hour, and the nighttime sweats can be extremely difficult to deal with because it disturbs sleep. There can also be emotional changes. Now, it's important to remember that around the age when a woman is going through her menopause, often there are social circumstances will be changing. Maybe children are getting married, maybe children are leaving home, there may be more family bereavements. So there's a lot of social circumstances can lead to the emotional changes that a woman goes through, as well as a decrease in hormone. However, women that do suffer from anxiety and depression do find that sometimes their symptoms get worse during the menopause. The other change that happens are urinary changes, and this again is due to the decreasing estrogen level in your body. The bladder becomes a little bit more irritable, the vaginal area becomes dry, and that can lead to something called urgency. That's the feeling of needing to pee very, very quickly, and you rush to the toilet, and unfortunately sometimes accidents can happen. Women can also be more prone to urinary infections. Another common symptoms of menopause is vaginal dryness, and this is again due to the decreased estrogen, which decreases the natural lubricant in your genital area. This can cause pain during sex. It can also cause urinary change problems. There can also be a decreased sex drive, and that, along with the vaginal dryness, can obviously have a big impact on the sexual relationship between a husband and wife, and it obviously causes emotional stress as well. The other thing to remember is that the decreased hormone in your body can increase the risk of certain other medical conditions such as heart disease and thinning of the bones, osteoporosis. Okay, let's talk about management options. Now, we know as a fact that women that are more active and healthy seem to manage their symptoms a lot better. We know that decreasing your sugars and the processed foods in your diet also helps manage the symptoms. So if you're not already doing so, decrease your caffeine intake, make sure your diet is balanced full of fruit and vegetables, and get some physical exercise. I cannot stress enough the importance of the food that you choose to nourish your body, and the fact that your body is made to be physically active. So if not, it's a great stage of your life to be reflective, and if you're not doing all those things, then again, seek help, speak to your doctor, speak to your nurse about advice on diet and exercise, and get yourself physically active and make sure you're eating well, because it does help with the symptoms of menopause. And again, I did mention about the increased risk of certain medical conditions. So if you are, because of the decreased level of estrogen, so if you're eating well and exercising, that will counteract that. Another way we treat the symptoms of menopause is through hormone replacement therapy, HRT. Now, if you're having distressing symptoms, please go speak to your doctor, because it could be that you're suitable to get HRT. Not all women are, however, speak to your doctor, because the vast majority of women, HRT can be life-changing. Now, there has been some controversy around HRT and the risks associated with it. However, evidence shows us that for a majority of women, the benefits outweigh the risk. And for, like I say, for many women, it can be life-changing. Hormone replacement therapy gives you back the estrogen that is lacking in your body. Again, it can be protective against heart disease, certain cancers, and osteoporosis. It usually comes in pill form or in a patch form. But again, like I say, speak to your doctor, because there will be some women, because of the medical history, they may not be suitable for HRT. And I'd like to mention that yes, there are alternative treatments out there for menopause, various herbal remedies like black cohosh and red clover. Again, speak to your doctor and see what's suitable for you, because there's some evidence to show that they may help in mild symptoms of hot flushes and menopause. To summarise, I think it's very important to remember that menopause is not a disease, it is a new stage of your life, and it's very important to remember that this is a stage where you can focus on yourself, focus on your physical well-being and your emotional health. It's also a time where social circumstances are changing, so a time to be reflective and just accept the new stage of your life and enjoy it. Please be aware of the symptoms that do require investigations, like heavy, painful periods, prolonged bleeding, and speak to your GP about it. Menopause Matters is a great website with lots of information, so please go check that out and have a read of that. Assalamu alaikum, thank you for listening to our topic on Menopause Matters on our health show.